Hello everyone, hopes all of you are fine and welcome to my channel. Today we will discuss about types of hemorrhage. There are 5 types of hemorrhage. Number 1, revealed hemorrhage. Number 2, concealed hemorrhage. Number 3, secondary hemorrhage. Number 4, primary hemorrhage. And number 5, reactionary hemorrhage. Revealed hemorrhage. In revealed hemorrhage, arterial wound is open externally. And in concealed hemorrhage, bleeding occur in a cavity, means internal bleeding occurs. In secondary hemorrhage, after 7 to 14 days, arteries release blood for shedding of arterial wall. It is called as secondary hemorrhage. Immediate bleeding is called as primary hemorrhage. And in reactionary hemorrhage, if the bleeding occurs after 72 hours, then it is called as reactionary hemorrhage. Now we will discuss the management of hemorrhage. Degree and classification of blood loss. Class 1, Class 2, Class 3, Class 4. In Class 1, 15% blood loss occur. In Class 2, less than 15% blood loss occur, and in Class 2 more than 15% blood loss occur. In Class 3 30 to 40% blood loss occur. In Class 4 more than 40% blood loss occur. Bleeding is controlled normally by compression. Breathing airway control is controlled by applying breathing apparatus. Fluid management is done by drip or plasma, and blood is managed after cross matched. History of accident give clues for loss of amount of bleeding. Now we will discuss about metabolic response to injury. First of all, hemostasis. Hemostasis means constant physiological stage. Steady state is a state which further fluctuate to environment. Constant state. Body response to protective response. Graded nature of injury. Now we will discuss graded nature of injury response. First of all, injury occurs, healing response occurs, and immunological response occur, physiological response occur. In elective surgery, extra burden on body give more response. Systemic inflammatory response, body shows hypermetabolic catabolism more. In case of major trauma, inflammatory response genetically. Now we will discuss dose metabolic response. Body not give metabolic response according to injury. As time pass, body response is more complex. There are 2 types of immunity: innate immunity and acquired immunity. In acquired immunity, there is inflammatory response, and innate immunity pro-inflammatory response to show body's active inflammatory system. Now we will discuss mediators to metabolic response to injury. Emergency hormone, catecholamines. Emergency hormones are catecholamines and corticosteroids. Afferent fibers and sends information to spinal cord. From spinal cord, information goes into thalamus. From thalamus, it goes into pituitary glands. In pituitary glands, it sends signal to anterior pituitary gland. Corticotrophin releasing hormone then stimulates adrenocorticotrophin hormone, and then which activates adrenal gland, and cortisol is released. Emergency hormones are glucagon, adrenaline, noradrenaline, cortisol, epinephrine, and norepinephrine. Immune response. Pro-inflammatory mediators activate interleukin 1 and interleukin 6/8, which then causes pyrexia, proteolysis, develop resistance to insulin, which then brings body in catabolic state, inflammatory state, and causes destruction.